Root canal therapy, sometimes referred to an endodontic procedure, is a type of dental treatment that can be used in order to save a tooth which has become damaged or infected. When undergoing a root canal, the inflamed or infected tooth in the tooth is extracted, the inside of the tooth gets cleaned and disinfected. The tooth is sealed by crowns or fillings to avoid the tooth from further destruction. Why is an appointment for a root canal required to begin with? In this short video, we'll explore what a root canal actually is, as well as the reasons why it might be needed, and also what is involved in the process. What is a root canal? The root canal is the procedure that takes place whenever the pulp and teeth becomes infected or affected by inflammation. This is the soft tissues in the tooth, which is home to nerves, blood vessels, and connective tissues. When the pulp gets injured or inflamed, it could cause pain that is severe and may cause damage to the tooth and adjacent tissues. When performing a root canal, the dentist will anesthetize the region around the tooth, which will ease any discomfort. They will then create a tiny hole in the upper part of the tooth, allowing access to the pulp that is inflamed or infected. The damaged pulp is taken out, and then the inside of the tooth cleansed and disinfected in order to get rid of the bacteria or other dirt. When the inside of the tooth is cleansed, then the dentist will seal the root canals using an emulsion of rubber called gutta percha to close them and avoid further infection. A filling or crown is inserted over the tooth to give it its original appearance and shield it from further injury. The reason why a root canal is needed? There are many reasons why an appointment with a dentist may be needed. The most frequent reason is that the pulp within the tooth gets infected or inflamed as a result of injuries, decay, or a damaged tooth. If untreated, this may cause severe painful abscesses, pain, or sometimes even loss of tooth. The other reasons the need for a root canal could be dental procedures repeated for the same tooth. A large cavity extends to the pulp. Dental trauma. Genetic influences that make certain individuals more prone to dental decay and infection. Sometimes the need for a root canal could be needed even when the tooth doesn't cause discomfort or pain. It is due to the fact that a damaged or inflamed tooth can result in more serious issues that include abscess or infection, which can extend to other parts in the body. What does an operation for a root canal involve? A root canal treatment usually requires just about 1 to 2 visits with the dentist, contingent on the extent of the problem and the complex anatomy of the tooth. On the first visit, dentists will be able to numb teeth and open up an access point to the pulp that is infected. The pulp then is taken out, and the inside of the tooth will be cleaned and treated with disinfection. If the tooth is infected to a high degree and the tooth is in a bad state, the dentist might put in a temporary crown so that the tooth can heal prior to placing the permanent filling or crown. If the situation is more difficult, the dentist might use an instrument known as a dam made of rubber to seal the tooth and safeguard it from bacteria and saliva in the course of treatment. Once the root canal procedure is done, the tooth will experience sensitivity for a few days. This can generally be controlled with a prescription medicine for pain. Be sure to comply with your dentist's recommendations on post-treatment to ensure proper healing and to avoid any problems. In the end, it is the only way to preserve a tooth that is infected or damaged. Though the thought of having an actual root canal could seem intimidating for many, it's actually a secure and efficient treatment that will help you restore your oral health as well as save your tooth's natural structure. If you're suffering from severe teeth pain, swelling, or discomfort to temperatures cold or hot, it's important to consult your dentist as soon as you are able to identify the need for a root canal. Be needed. Keep in mind that early detection and treatment is a great way to avoid future damage to your tooth's health in the future.